All right, so the nice thing about, well, quick review, okay? We have the 4 tissues of the body: epithelial tissue, connective tissue, muscle tissue, and nervous tissue. Where is skeletal tissue? What category does that fall in? I kind of heard it, but no, skeletal, not skeletal muscles, but the skeletal bones. Where do those fall? Connective tissue. Yeah, connective tissue. So you have the 3 types of connective tissue: connective tissue proper, supportive connective tissue, and then fluid connective tissue. Well, we can rule out fluid connective tissue. We know it's not that. It's supporting connective tissue, okay? So here we can see, as we jump into here, all right, when we go over this chapter, yes, we're going to be spending the majority of our time talking about, all right, the bones, all right, but we are going to address some of the other structures that are involved in our skeletal system. Right, cartilage, which is another type of connective tissue, ligaments, which is part of connective tissue proper, right, and then we'll talk about some of the other connective tissue structures. The tendons, you can't talk about the skeletal system without discussing tendons, because tendons attach muscles. Right, so we'll go through some of this stuff here. Okay, so you have to think of the bones, the individual bones, as an organ, and I know it's kind of weird because I'm used to thinking the pancreas is an organ, the liver is an organ, okay? But the bones are the organ of the skeletal system, okay? Much like the liver is part of the digestive system and its role of making bile and several different types of proteins and many other things, okay? So keep that in mind, please, all right, that they are an actual organ, because they will have, all right, several different types of tissues inside of them, all right? So obviously we know that the bones are going to make up our structural framework, and they have a certain characteristic of stiffness, rigidity, okay? Because if they didn't have that characteristic, we'd be blobbies, all right? And we wouldn't be able to support ourselves. So we're going to talk about, all right, all the different types of functions and characteristics of the tissues here of the skeletal system. But I want to talk about first about the 2 types of bones, and that's going to be compact bone and spongy bone. You do need to know, all right, the other names for these bones here, okay? So compact bone is also known as dense or cortical bone. And this makes up the majority, 80% of the mass of the bones, okay? Very dense, not a lot of space inside of that. The other type, the spongy bone, or the cancellous or trabecular bone, this is going to be found internally to the compact bone, right? So it'll look like a sponge or Swiss cheese appearance. So it only makes up about 1/5 or 20% of the mass of all the bone in our body, okay? So compact, much more dense, okay? Much more, I don't want to say massive, because that gives it the impression that it's larger, but just has a more body mass involved when we're talking about compact bone. All right, so now when we're going to talk about the other types of connective tissue here in our body, we're going to discuss cartilage, all right? So the 2 types of cartilage that we're really going to focus on are the hyaline cartilage, which is the most common or abundant type of cartilage in the body, and then there's fibrocartilage. That's like the weight-bearing cartilage that actually is going to be found in areas of your skeleton that undergo a lot of stresses, all right, from just simply having to bear the weight of the structural frame, all right, that makes up our body. So it won't be as rigid, all right, as bone, all right, has higher water content involved. It's going to be more flexible, all right? So hyaline cartilage is all over the place. We'll find it on the ends of our long bones because it's going to be found in those joint spaces there. The cartilage that attaches our ribs, all right, to the sternum, we give it a special name. We call that the Costal Cartilage, but that's just hyaline cartilage. All right, when you're developing, all right, inside mom, when you're a fetus, okay, when you start to take on that humanoid shape and you start to get the formation of the bones, they start off as hyaline cartilage, And then what will happen is, all right, your body will remodel that hyaline cartilage into bone. And we'll discuss that process there. All right, but it has to start off as a model for the bone formation that comes on later on. And then we're going to also talk about its role in growth plates. All right, we get to learn about how our long bones get longer. Right, and it has to do with our growth plates. All right, the fibrocartilage is only found in 3 places, and that's listed right here. The discs in your spine, all right, the menisci, which are like the discs in your knee, and then you have the pubic symphysis. And that's that disc-like structure. We'll talk about that when we go over the pelvis, that disc-like structure that sits in between. It's about 2 inches below your belly button. And it sits in between where the pelvis comes together in the front. Okay? So it's got one job, and that's to carry weight. Right? And it has to resist those compressive forces. All right, and then we have our 2 types of dense regular connective tissue, ligaments that connect, and you need to know this. All right? I lose sleep at night thinking that there might be a student that makes it through my 210 class that doesn't know that a ligament attaches bone to bone and that a tendon attaches muscle to bone. You know, I don't think there is such a person, but I want to make sure. So I'm going to hammer it into your heads. All right, so ligaments attach bone to bone. Okay? Tendons are going to attach primarily muscle to bone, but they can attach muscles to other muscles. They can attach muscles even to the skin. Okay? But for this chapter, we're going to say it's going to attach it to the bone. Okay? Any questions? Too fast, too slow? Okay. I'll even take a drink of water here real quick. I was doing some research over the weekend because I've got really nothing else to do. No, trust me, I got plenty to do. But sometimes when I'm sitting somewhere waiting to do something, I pull my phone out and I read stuff. I'm addicted to it. But I'm not on Facebook, all right? So I'm not killing time on Facebook. So I was reading this article about colchicine, which is a drug for gout. Blows my mind. And they're testing it and they're finding out that it's actually having some positive benefits for COVID-19. A gout drug. It's amazing. So I was like, oh, I knew it was a gout drug. I'm like, I want to see how this drug works. So what do? I'm going to look up the mechanism of action. And it says unknown. So they don't know how it works, but they know it works, or there's studies to do that. It always cracks me up when I read that. I'm like, wait a minute. And you'd be surprised that there's a number of drugs that people take that they don't know what the mechanism of action is. Well, like when they came up with Viagra, sildenafil, right? It was actually meant to be a blood pressure medication. So they were testing it and they found out, you know, if anything, it's not decreasing blood pressure, it's increasing the blood pressure. So like we're shutting down this study, it's not working out very well, we're shutting it down. And they said, all right, everybody, we're stopping the study, just turn in your drugs. Normally to do these studies, especially when they're in human trials, they do what's called a double-blind study, which means we're giving out drugs, nobody knows who's taking what. It's either placebo or it's the actual drug, but they don't know who it is. So they're trying to give back the drug, take the drugs back, and there was a certain population of people that were in the study that said, can we keep this? Can we keep this? And they found out that it was men that had erectile dysfunction. So that was an accidental discovery. But the point being is, you'd be surprised how many drugs that we don't know about that they've tried to use for a certain study, and they might find it for something else. It's amazing out there. Okay, so this picture here is showing us, all right, where we're going to find our hyaline cartilage, which is listed as the blue here. You can see it here as the costal cartilage. It's going to be found in the joints here of our long bones. We give it a special name when it's in those areas. We call it articular cartilage, all right? And we'll also see it here in the growth plates. And then you can see in the, let me zoom in a little bit, the kind of purplish cartilage, all right? That is our fibrocartilage, mainly in the axial skeleton here, in the intervertebral discs, located here, all right, in the pubic symphysis. And then we'll see it here in the appendicular skeleton down here in the menisci, okay? All right, so let's talk about the functions of bone. Okay, so the first one up there is really kind of obvious. You're going to look at it if you think about it. At least the first 2 functions that are listed there on the board. You don't have to take this class to know what bone does. All right, you know that it protects. You know, what's our skull do? It protects our brain. All right, our rib cage helps to protect your internal organs. right? Well, you know, without the bones, it wouldn't offer us that support, that upright posture that we have. Hopefully it's upright, right? So you can kind of figure that out on your own. Levers for movement. Well, muscles have to attach onto the bones because they're going to manipulate the movement of those bones. Right? So it's all, if you're into physics, you know, it's all different classifications of levers. And a lot of the joints in our body are class 3 levers. And if you want to, when you're reading in the book, you can, there is a small section on, I don't cover it in class, that talks about the classification of levers. If you want to, you can. But this one here, hemopoiesis, all right, that's that process I was telling you folks about, all right, of the blood, the formed blood elements, which are the cells that are flowing in your blood. So your red blood cells, your platelets, and your white blood cells, all right, are going to be made here in the bone. And that process is called hemopoiesis, and specifically the tissue that it's going to be occurring in is the red bone marrow. Right, because there's another type of bone marrow, it's called yellow, we'll talk about that later on. All right, it also acts as a storage facility, which is great. You know, there's a reason why they say drink milk, you know, it helps with strong teeth and bones, all right? Well, milk is supposed to have high amounts of calcium in it and high amounts of vitamin D. Calcium, actually, believe it or not, there is more calcium in a cup of broccoli than there is in a cup of milk. So green, leafy vegetables, if you really are looking for calcium, eat that. Way better, all right? Unless you like milk, which is fine. All right, but some of these minerals are going to get stored in the bones. All right, phosphates. What do we need phosphate for? Anyone remember? It's an ingredient for a really important molecule in our body. Bingo, ATP. Adenosine triphosphate. Okay, so ATP. So guess what? We're going to store that in the bone. Cool. So we can use that later on when our cells need energy. All right, calcium gets stored in the bone. Okay. So we need calcium. We're going to learn about the different roles of calcium. We need calcium for bone formation. Okay. We also need it for nerves to function, for muscles to contract, and for blood to clot. That's a lot. That's a lot. Okay. So we're going to learn about 3 out of those 4 things that I just mentioned. All right. So that's what we're talking about here for storage of mineral and energy reserves here. All right. So there's 4 types. Okay, long, short, flat, and irregular bones. Okay, so I think it's pretty much easy to figure out that long bones are going to be longer than they are wider. Okay, so bones like the femur, the tibia, all right, the fibula, those are bones of the leg. Okay, your humerus, which is the bone that goes from your shoulder to your elbow. All right, the radius and the ulna. Okay, again, those are bones that are going to be found in your forearm. Okay, so those are long bones. Our short bones are going to be equal, all right, in width and length. And the examples that are given up there are your carpals and your tarsal bones. Your carpal bones are found in your wrists. The tarsal bones are going to be found in your foot. All right, flat bones, obvious. We've already learned some of these flat bones when we were talking about lab last week. All right, those cranial bones, like the frontal bone, the temporal bone, the occipital bone, all right, parietal bone. Those are flat bones, bones of your face, your nasal bones. Okay. So those are your flats. The irregular bones, those there are going to be a little bit tougher. We haven't really talked about some of the irregular bones. Like the sphenoid bone, that's an irregular shaped bone. That's kind of weird. The ethmoid bone is really freaky. All right, that's an irregular shaped bone. Vertebrae, okay, which we'll talk about today in lab. All right, so they have just really odd, different shapes. Okay, so when we classify the bones anatomically, we'll use some of those terms there. All right, long, short. Okay, flat, irregular. So we'll see those. Here's some examples all throughout. Okay, so now, as I move through this chapter, I'm going to be mentioning terms, and so I want to kind of go over some terms with you so you know what I'm talking about. Because when we're talking about certain parts of the bone, you might hear me refer to, especially when we're talking about a long bone, all right? I could refer to the shaft of the bone. Well, guess what? We got a special name for that. So I'll be referring to it by its special name, diaphysis, or the epiphysis, which is the ends of these long bones. So we're going to learn some of that terminology here, all right, when we're talking about some of these bones here. Okay. So let's start off when we're dealing with the long bone. You're going to find out that in this chapter, when I'm going over certain things about the bones, I'm going to be using long bones as a lot of my discussion. Okay? So let's break it down. All right? So the long bone, the shaft of the long bone is called the diaphysis. We'll see a lot of structures attaching onto the diaphysis. All right? So it's going to function as a point of attachment for levers to occur. Okay? So we'll see quite a bit of that compact bone within the diaphysis. Remember, that spongy bone or trabecular bone, all right, is internal to that. All right, so just internal to that is we'll see the spongy bone. Okay, so if I were to cut your femur in half like that from top to bottom, all right, femur's hollow. All right, so this part that I'm shading in, that's the compact bone. And then you'll have the spongy bone, which comes off the internal portion, and it looks like a sponge, all right? Just these little spicules coming off, which are called trabeculae. I'm not even doing it justice as I'm trying to draw it in here. All right, but it looks porous, so that's going to be the spongy bone. So the hollow area in the center of this example is the medullary cavity. It's a space, okay? Helps to make our bones what? There's a space in the center of these bones, and it's hollow. What do you think it does for the bones? Instead of it being completely bone throughout, but there's space in there. Makes them lighter. Yeah, makes them lighter. You weigh so much more. It helps to give it movement too. Yeah, and I won't get into the, you know, it's funny that you said that because, who was that? Was that Alexis? That was Alexis. Because if you, without getting into the physics of it, believe it or not, the bones are much more conducive being hollow, all right, to being actually a stronger formation, so they're less likely to fracture, okay? But also does make it easier to move, because if your limbs are lighter, it makes them easier to move. But imagine if our bones were just solid bone all the way through, how big our muscles would be. We'd be jacked, you know, because your muscles would have to adapt to that, okay? All right, so when we talk about the medullary cavity, this is in what we're going to see in long bones, that there's bone marrow in these areas here, all right? But in kids, because the kids, their skeleton is much more active in producing, all right, blood elements, those cells, we're going to see the bone marrow in the long bones of kids being red. Red means it's active, it's doing stuff, it's making things, okay? But in adults, all of us, all right, when we go into the medullary cavity, it's going to be yellow. What else is yellow? What other tissue in our body is yellow? Adipose. Yeah, adipose, what you said. Fat, that's right. Yep. So that's what happens. When red bone marrow goes inactive, it turns to yellow bone marrow. And it has a little bit more of a fatty consistency to it, but it can always revert back if needed into red bone marrow, okay, which is kind of cool. So we can call it, it's like the reserves, like for the Army, okay? Call them into active duty. All right, so the ends of our bone, so we talked about the diaphysis, and that's this part here. That's the shaft, okay? And at the end of the diaphysis is a knob, okay? And that's called the epiphysis. All right, so you'll have two of them, one on each end, okay? The one that is closest to the axial skeleton, or the trunk of your body, is going to be known as the proximal, obviously, epiphysis. The one that's further away from the axial skeleton, or the trunk of your body, is going to be the distal. All right? So same type of makeup, though. The outer portion of the epiphysis is going to be that compact bone. Then just internal to it will be the spongy bone. All right, very similar, all right, to the diaphysis. So far, so good. Not too bad. We learned a couple new terms. All right, diaphysis, which is the shaft of the bone. The epiphysis, which is the knobby end, the one that's closer. Like if I'm talking about the humerus, which is the bone in my arm. All right. So the one that is in my shoulder joint, that's going to be the proximal epiphysis. The one that's in my elbow joint will be the distal epiphysis. Okay. All right. So let's talk about another type of connective tissue. That is going to be our hyaline cartilage, right? But when we describe the hyaline cartilage that sits on the end of our bones, right, in a joint, we give it the term articular cartilage. It articulates, okay? So this is going to be found on the epiphysis, and it coats the epiphysis, right? Articular cartilage or hyaline cartilage has a glassy-like appearance, which is good, because cartilage is going to help to reduce friction. It also acts as a shock absorber, okay? So those two classifications, or those two characteristics, I should say, all right, really are important when we're dealing with joints, because if we didn't have the articular cartilage there, when bones scrape on each other, you think that feels good or bad? Bad. You ever heard of somebody when they talk about their knees and they're the age of 77? They're like, I got no cartilage in my knees. It's bone on bone, you know, and they're always in pain and their knees are swollen. That's because they've already gotten rid of all their articular cartilage. The bone tissue is grinding on itself. When it grinds on itself, it causes inflammation. Inflammation is part of the healing process, but it also is part of the degenerative process, especially if it's chronic. So it starts to destroy that tissue, wears it down. Bones are very, very sensitive. There's nerves that run, and we'll talk about it. There's sensory nerves, not motor nerves. Motor nerves go to the muscles. Sensory nerves located throughout the bone. All right, so it's a very pain-sensitive structure. Okay? Okay, so again, articular cartilage is that thin layer of hyaline cartilage that sits in the joint space there. Okay? Helps to reduce friction, helps to act as a shock absorber. All right, so going back to my bone here. All right, so we saw, here's the epiphysis, here's the diaphysis. I don't know why it's doing that. Okay, so the skinny part here is the diaphysis. All right, the big knobby part here is the epiphysis. But what about this space right here in between, where the epiphysis, all right, is actually going to kind of transition into the diaphysis? That is the metaphysis. All right, so that's that transition area between the epiphysis down into the diaphysis. In a younger person, all right, like an 8-year-old, that region is occupied by the growth plate, or the epiphyseal growth plate. It's located there. And that tissue is made up of, there's that hyaline cartilage again. Okay, and what happens is, all right, it pushes, the active growth area is here, right, and it pushes down. And by doing that, it pushes the knob away. We'll get into that. Don't worry if you don't understand that. All right. So when you're done growing and you hear the term, oh, the growth plate is closed. Okay, that means there's no more hyaline cartilage in there. It's all bone now. All right. We refer to that as the epiphyseal line. And that just shows you where the growth plate used to be. Eventually closes, it fuses, and done. No more growth going on there. Okay, so in pretty much all of us, all right, in this room, all right, not every single growth plate in your body is closed, but for your long bones, it's pretty much. All right, unless I'm underestimating everyone's age here, or most people's ages. Okay. Although I did hit a late growth spurt in my mid-20s, like an inch or two. Maybe my posture just got better. I don't know. Okay. So here, that slide looks messy. Get rid of that. Okay, so we're going to see the epiphyseal growth plate in the metaphysis. The metaphysis is that kind of triangular area, all right, or that tapered area between the epiphysis and the diaphysis. All right, and that's where we'll find the epiphyseal growth plate. Made up of hyaline cartilage. You need to know that. Okay, growth plate is made up of hyaline cartilage. All right, so that's what this picture here is kind of showing us some of the. Okay, so now you can see it's always better with pictures. Okay, so here's the diaphysis, that long, long portion of the bone, the shaft there. Okay, and you can see it's hollow inside. All right, this is a mature adult bone because there's no epiphyseal growth plate here anymore. Okay, so we're looking, You have a nice medullary cavity. That's that hollowed out space in here. That's where you're going to find some of your bone marrow, okay? And you're going to find lots of blood vessels, some nerves down in there, okay? But if you look closer, I'll zoom in more. You can see the outer portion here of the diaphysis is compact bone. And then just inside, where you see these little holes there, that's representing the spongy bone. And it's the same here when we get up into the epiphysis, compact bone on the outside, and then on the inside you can see here all that is spongy bone. All right? So the knobs here at the end, that's the proximal epiphysis. We go down here to the bottom. This will be the distal epiphysis. All right, then that transition area here where it starts to taper down, that's the metaphysis. Okay? Feel good about that? Not too bad? So far, so good? Okay. All right. So you ever wonder why? Has anyone here ever broken a bone? You have? Which bone? Both my wrists. Both your wrists. Did it feel good? Or did it hurt? It hurt. And the reason why it hurt is because of this. Periosteum. Periosteum is this covering to our bones. All right? It's made up of 2 layers. But the periosteum is very pain sensitive. It gets a lot of sensory nervous sensation, information. And there's actually a very rudimentary, it's kind of a, I don't want to call it a barbaric way, but it's a crude way of testing somebody that has broken a bone if you can't see an obvious fracture in the bone. You can use a tuning fork or an ultrasound machine. Not the ultrasound machine that you go to see what the baby looks like, a machine that actually emits ultrasonic radiation, not radiation, excuse me, ultrasound waves. Okay, and so what that does is, all right, is that if you use a tuning fork or the ultrasound device, and you put it over the site that you suspect is a fracture, you don't have an X-ray machine or whatever, the vibrations from both of those instruments will vibrate if the periosteum is compromised, all right, the periosteal pieces, and they'll start to move, and that movement is painful. You'll get somebody to shoot right off. They're sitting on a table, they'll shoot right off. Not pleasant, but if you don't have an X-ray machine, it helps in a pinch. So our periosteum, all right, has 2 layers. An outer fibrous layer, and you need to know this, it's made up of that dense, irregular connective tissue. This is where all the stuff is going to attach onto. Okay, so ligaments and tendons will attach onto that. All right, nerves and blood vessels will be attached onto that. Okay, so it basically is going to protect the bone, all right, from stuff around the bone. All right, then just internal to that is the inner layer. We call that the cellular layer, and that's where we're going to find these cells. I'll talk about them soon. Okay, the Osteoprogenerator cells and the Osteoblasts, and then our osteoclasts. Okay. 2 of those cells help to make bone. 1 of those cells helps to destroy the bone, which is okay. Okay, which is okay. So we have to figure out a way to attach this periosteum to the bone. So we do so with collagen fibers, our protein fibers. So of course we give them a special name, all right, called perforating fibers, but also called Sharpie's fibers. Okay, and they attach the periosteum and hold it to the actual compact bone. All right, we don't want it slipping off there. You need to keep it close. Okay, so they're called perforating fibers, also known as Sharpie's fibers, like the pen. Sharpie? I don't think it was the same guy or girl. Okay. Questions about periosteum? How many layers? 2. Okay. Inner cell layer, osteoprogenerator cells. We'll talk about the role of all those cells in a moment. Osteoblasts, osteoclasts. The outer layer is that fibrous layer, and that's going to be made up of the dense, irregular connective tissue. Okay? Dense, irregular. So it's like a sleeve. So here you can see it. I love this picture. Okay, so here you can see this is actually compact bone right here. All this is compact bone. Okay, and so what you're seeing here, all right, are the lacuna with the osteocytes living in it. And then directly on the outside of the bone, you have the periosteum. So this thick layer here, all right, that's the fibrous layer, made up of tons of collagen. Okay, and then just deep to it, we have our intercellular layer, and that has those cells there. All right, and then you can see the Sharpie's fibers, the perforating fibers, all right, showing how it attaches to the compact bone. Let's turn that off. Don't want my phone going off when we're in class. Okay. So we have a covering on the outside of the bone, we call it periosteum. But guess what? We got another covering on the inside of the bone. It's going to be seen kind of coating, all right, the medullary cavity there. Okay, so outside is periosteum. Right, endo is on the inside. That's endosteum. Right, that's going to cover the internal structures. All right, so we'll have cells in the endosteum. It won't be as continuous as the cells that we saw in the periosteum, on the intercellular layer. Okay, but we're going to carry the same cells. Osteoprogenerator cells will be found here, osteoblasts, and our osteoclasts. Okay? So again, endosteum is on the inside, periosteum is on the outside. All right, and we're going to talk about these roles because if you have cells on the outside of the bone and cells on the inside of the bone, and some of those cells make bone, okay, then we're going to see how that bone-making process occurs. Because we're going to grow bone from the inside out and also from the outside in. You're probably thinking, what the heck does that mean? I'll explain it to you. All right? I will explain that to you. But right now, let's just learn, all right, who's doing the what. Okay, the osteoprogenerator cells, all right, the osteoblasts and the osteoclasts. And they're going to be on the inside, the endosteum. Okay? All right, so here's a picture of the endosteum. Okay, so what you're seeing here, all right, this is one of the trabeculae, right, because we're on the spongy bone. All right, so on that inner portion of that trabeculae, those little spiky things that are coming off our spongy bone, you can see the endosteum. Here's one cell. Look at the size of that thing. That's one of my favorite cells. That's an osteoclast. All right, it's a cool cell. This is the one that starts to break down bone. All right, and then you can see over here, all right, we have our osteoblasts, all right, and then our osteoprogenerator cell. We'll talk about all those roles here. And we still have our osteocytes. That's that mature bone cell, and it's sitting right here in its little chamber there. What's the name of the chamber? Lacunae. Yeah, lacunae. Good, good, good. Yep. Space, chamber, whatever. Okay, so that's all long bones. That was all long bones. Now we're going to talk about some of those other types of bones that we learned. Remember? Short bones, okay, flat bones, all right, and irregular bones. That's what we're going to talk about now. We can't just talk all about the long bones. All right? So these bones here are going to be different than the long bone. All right? Because one, all right, depending on its location and it's the actual makeup of the bone, all right? So we're going to see some differences, and I'll explain that in a second. But they're similar in the fact that the external part of the short, flat, and irregular bones is still made up of compact bone. And then just internal to the compact bone, you'll have that spongy bone, okay? But here's an important factor. You need to star this. No medullary cavity. None. Okay? So short, flat, irregular bones do not have a medullary cavity. They're not hollow. All right? And then we give a special name when we're talking about flat bones of the skull. All right? When we're referring to the spongy bone, all right, and we're discussing the flat bones of the skull, we call that diploid. All right. So I kind of described the makeup of these types of bones like a peanut butter and jelly sandwich. But actually, no jelly, just peanut butter. All right? The bread is going to be the compact bone. And the peanut butter is going to be your spongy bone. There's no cavity. I make the best peanut butter and jelly sandwiches, by the way. My kids have told me that. All right? I know. All right? They'd much rather have me making it than my wife, because she doesn't know the correct ratio. You know there's a right ratio in making peanut butter and jelly sandwiches. It's a 3-to-1 or 4-to-1 peanut butter to jelly. It's got to be on white bread. Because first of all, peanut butter and jelly sandwiches aren't healthy to begin with, so go all the way. You know, you put it on wheat bread, and I don't know anybody that puts peanut butter and jelly on rye bread. There's just something wrong with that, all right? Or pumpernickel, okay? Okay, so this is really what I want you to remember. No medullary cavity, none. Okay, when we're talking about short, flat, and irregular bones, okay? But it's similar in the fact that the outer part of the bone is compact bone. The internal portion is spongy bone. Same thing. So that similarity remains. Okay? It's just there's no medullary cavity. And then when we're dealing with the flat bones of the skull, all right, when we're talking about the spongy bone, we call that diploid. All right, I got a picture here. So here it is. Here's our peanut butter and jelly sandwich of the skull. All right, so we've taken the flat bone here. All right, we've cut a piece out of it, and you can see the compact bone here. All right, that's the white bread. All right, and then in between here, there's the peanut butter. All right, but again, since we're talking about spongy bone, then since we're dealing with the flat bone in the skull, it's diploid. All right, you don't see medullary cavity there, do you? Nobody? Anybody? No, of course not. All right, so we don't see that there. Don't be fooled on a test. Okay, so I want to go over some of the pieces and the machinery of our bones, and to do that, I do need to talk about blood and nerves, okay? So because if you think about it, one of the functions of our bone is an energy reserve or energy storage site and a mineral storage site. But if we say we need to, say my blood calcium levels drop, right? They're just low, okay? So my body's gonna be like, hey, I gotta find calcium somewhere. I gotta find it somewhere, all right? Where can I find calcium? Okay, well, one, I'm gonna make the kidneys, I'm gonna have them stop getting rid of calcium in the urine. So I'm gonna not shut the kidneys down, but I'm gonna turn the calcium, all right, excretion in the kidneys off. So it no longer is gonna get excreted in the urine. We're gonna keep it, we're gonna recycle it into the blood. But now I've still gotta get calcium from somewhere. All right, I'm going to absorb more calcium from my digestive tract because maybe I had that cup of broccoli and I want to get all that through. But where else can I go? I'm going to go to the bone, all right? Because remember, the calcium is stored in the bone. It's stored, and we'll learn this, in the form of hydroxyapatite, called bone salts. That's what makes bone hard. Calcium helps make bone hard, all right? So I'm going to go in there and I'm going to get that calcium out of there. It's like the 7 dwarves going and mining in the mine and bringing it home. Whatever it was, okay? So I'm going to go get calcium from my bones, but I got to find a way to transport it. No problem. Blood vessels. Bone is highly vascularized. It's an organ, right? Your stomach's an organ. There's a lot of blood vessels around that. A lot of blood vessels around your small intestines, right? Because you got to digest and absorb all that information. All that, you should be absorbing this information that I'm giving you. It's going to absorb all that nutrient, all right, from your digestive tract. Okay, so bones are highly vascularized. Right, you got a lot of blood vessels in there, right? And of course, we're not going to really see blood vessels in the compact bone. There's no room for that. But guess what? We'll see it in the spongy bone. All right. So how does a blood vessel get into a long bone? All right, it's going to enter first through the periosteum. It's got to pierce through the periosteum, right? And then it's going to find a hole in the long bone. So we give that a name. Remember, what's a rounded hole in a bone? Foramen. Yeah, a rounded hole in a bone for a passage of either a blood vessel or I was going to say a vein or a nerve. Okay, so something's going to go through that foramen. Well, in these structures here, we call those nutrient foramens. So blood vessels can enter into the bone and they can exit out of the bone. Are foramens almost always holes where veins are? Correct. Yep, for the most part. I will not say that for everyone because there is, and we'll talk about it, there is a foramen that we'll talk about. It's called the obturator foramen. You won't have an artery or a blood vessel travel through that foramen or nerve, okay? But for the most part, yes, okay? All right, So that's what we're going to see. The nutrient foramen is going to be this hole that veins and arteries can enter into. Okay, as you know, an artery is coming from the heart out to the tissue. A vein is going to come from the tissue and bring blood back to the heart. Okay, so one goes in, one comes out. All right, so you heard me say earlier that the nerves that go to the bone are mainly sensory nerves. Sensory nerves. All right, so they will also go through this foramen. All right, but they're going to go inside the brain, inside the bone. All right, and it's going to stimulate the periosteum, the endosteum, and the bone marrow. So what does all that mean? Well, if I have low red blood cells, and I need to make more red blood cells, my nervous system plus my hormone system, the endocrine system, can help with that. But we can start to turn on the machinery. We can turn the red bone marrow on. Let's make some more red blood cells, all right? Or let's make some more white blood cells, all right? Same type of situation. These sensory nerves, all right, can sense, like say, for whatever reason, I go up to space, and I'm going to live in space for 5 years. I'm in a non-weight-bearing environment, zero gravity, okay? And if I'm in a non-weight-bearing area, region, environment, what have you, all right, the pressure on my bones will sense that. And what they'll do is they're like, well, you know what? They'll think that I lost weight. And they'll think that, okay, well, we can start to resorb the bone. You don't need as much bone anymore. You don't need to bear weight on your bones because you're not as heavy. So we're going to decrease. Those sensory nerves are going to sense that information and start that whole process. Point being is, you know, think about the nervous system as that communication system. All right, that's how your body's going to communicate. That in the endocrine system. It's important that you understand that. Okay. All right. So one of the other types of connective tissue that we'll see is going to be our bone marrow. All right. We refer to it as a myeloid tissue. When we talk about myeloid tissue, that has to do with the blood cells. Okay. And it is a connective tissue. All right, like a reticular connective tissue. You've seen that before. All right, so there's two types, red and yellow. Think of the red as the active, and think of the yellow as the non-active. What happens to people when they're non-active? All right, when they're sedentary, they can increase, all right, adipose tissue. All right, so this is what happens. Now, when it's active, all right, we are going to be making blood cells, red blood cells, or erythrocytes, white blood cells, leukocytes, and platelets. Okay. So, in addition to the reticular connective tissue, we'll also see a bunch of our immature blood cells because they haven't grown up yet. It takes a little bit of time, right? And we'll still have fat because guess what? Fat's great. Energy. Energy, energy, energy. Love it because it's going to take energy to make stuff. Okay? So in young people, like our kids, we will see, all right, red bone marrow throughout the body. So that includes the medullary cavity of long bones. And it's going to be scattered, all right, throughout the spongy bone regions of your bone. Okay? But in adults, it pretty much stays in our axial skeleton. And we already know our axial skeleton, what that is. The skull, the vertebrae, okay? So first two things listed on here, we already know. Well, what else? Ribs and sternum. We don't know this. We haven't learned the os coxae yet. All right, that's going to be your hip bone. And then the proximal, all right, the epiphysis, the proximal epiphysi of your femur and your humerus. And those are going to be found in your hip joint and in your shoulder joint. So pretty much in adults, and all of us here, our hemopoiesis, of that process, of that hemopoietic activity, is occurring pretty much in or close to your axial skeleton. Okay? But in kids, it's almost all over the place. Virtually the whole skeleton. Okay? Questions about that? I feel like I'm going through this material relatively fast. So let's talk about yellow. There it is, fatty substance. So as we grow and get older, okay, when we're a kid, we don't need, right, that red bone marrow to produce the cells anymore. So it'll start to become more inactive. And eventually, when it's inactive, it will convert into that fatty substance there. Now, here's the thing that you have to really understand. When you ever have somebody that has fractured their leg, okay, and if they fracture their leg to the point, especially the femur is a big one, but some of the other bigger bones like the tibia, complete fracture, where you've exposed that medullary cavity, okay, that has that yellow bone marrow there. You're at risk of a fat embolus, okay, because these bones are highly vascularized. You could throw a fat embolus from that from that yellow bone marrow. So that's one of the things that you might think, that's no big deal, I broke my leg, all right? I shouldn't be too concerned, all right? But one of the things that they do consider and are concerned about is that possibility of that yellow bone marrow getting thrown into the vascular system and causing a clot, an embolism, dying, okay? Okay, so what I don't know if I mentioned this or not, but the yellow bone marrow can convert back to red bone marrow in cases of when your red blood, well, any of them, white blood cell, mainly red blood cell levels decrease. One of the causes would be low blood oxygen levels. What carries your blood oxygen? Red blood cells. So we need to make more, right? And we call that pathology anemia, okay, when you have reduced red blood cells. And so what will happen is your body will release erythropoietin, all right, EPO, which is a hormone found in the endocrine system. Your kidneys actually make it. The liver does a little bit, but the kidneys are primary. And they'll stimulate red blood cell production through the red bone marrow. That will also cause the yellow to convert back into the red. So here you can see, this is an adult person, all right, you can see pretty much, all right, the axial skeleton is lit up, all right, all the sites for hemopoiesis here. And then you can see the proximal epiphysis in the humerus and the proximal epiphysis here in the femur. Oh, yes. It's one of my favorite subjects to talk about. I don't know why. All right, I like bone. Okay, so we're now going to jump into, all right, because we're not the next step, but we're going to start talking about how bone grows, right? And we're going to learn how your hyaline cartilage fetal skeleton is going to start to turn into an actual bone, an osseous skeleton. But to do that, we have to understand, all right, the players in this. And that's going to be these cells here, all right? So, bone is connective tissue, right? We said it was supporting connective tissue. So there are two parts to connective tissue. There's the cellular component and the extracellular component. And the extracellular component, all right, is made up of what? Two things. You guys remember? Two things for the extracellular matrix. GS, what's that stand for? There you go. And then, so what's the other part? Protein fibers. Protein fibers. Okay? So remember, connective tissue is cells, ground substance, protein fibers. Okay? So I'll put PF. All right, so here we're just saying you have cells and then everything outside the cells, which is the extracellular matrix. Okay? But I'm going to keep reminding you what makes up, all right, this connective tissue. So we're going to learn. Now we're going to start off here and we're going to learn about the cells. All right, then we can learn about the extracellular matrix in a bit. Okay, so let's start off with the cells. So there's four types. Four. Okay? Osteoprogenerator cells, osteoblasts, osteocytes, osteoclasts. All right? Four. So we're going to see what their role is in not only making bone, but then tearing down bone and then making it again. Okay, like when you fracture a bone, how does it heal? How does that happen? Which of these cells plays a role in that? You know, are these cells working right now as we're sitting here in our chairs? Yes, yes, they are. Okay? So let's start off here and talk about the first one, the Osteoprogenerator cells. Okay? These cells come from what? We saw that. We know what mesenchyme is. That's that embryonic connective tissue. That's where all the connective tissue comes from. Okay? So connective tissue, actually, when I go through the three types of connective tissue, all right, the connective tissue proper, the supportive connective tissue, and fluid connective tissue, all of that connective tissue comes from here, from mesenchyme. Okay? Comes from mesenchyme. So here's what's going to happen. These osteoprogenitor cells are going to divide. Okay? One of them will stay as an osteoprogenitor cell. The other one, the second one, is going to be what we call a committed cell, and that's going to be an osteoblast. Okay? So that's what this is saying here. Cellular division yields another stem cell. What's our stem cell? This osteoprogenitor cell. And what's our committed cell? Osteoblast. Okay? Where does this happen? Well, where do we see the cells? On the outside of the bone in the periosteum, specifically in the inner cell layer. And where did we see the other group of cells? On the endosteum. That lines the medullary cavity, found on the spongy bone, on the trabeculae. Okay? That's what we're going to see. So osteoprogenitor cells have a relatively, I won't say easy job, but they have one thing. They divide. Okay? They undergo, all right, mitosis, and they'll make another osteoprogenitor cell, and then the second cell that's produced will be that committed cell. Right? And when that committed cell grows up, it's an osteoblast. Good so far? Okay, cool. I like it. Okay, so what's an osteoblast? First of all, when you hear osteoblast, think build. B-blast, build. They make bone. That's the job. Okay? But this is important. I'm going to beat this into your heads. I don't care if it takes me all semester. They make, all right, and they secrete osteoid. Okay? Bone has two components to it, which we'll see here shortly. It has an organic component, and it has an inorganic component. Okay? This cell makes the organic component, and we call that osteoid. Okay? It's going to make the matrix, the bone matrix. It's like wet cement. Okay? You got wet cement, and I'm going to put something into that wet cement to make it hard. Okay? So these cells make our osteoid. So they synthesize and secrete it. That's eventually going to form the bone matrix. All right? And when we actually sprinkle in some calcium and some phosphate and some other things into this osteoid, it's going to harden. Okay? And that process of hardening is called calcification. We'll get into that. And what will happen then to this poor cell, right? This is that Count of Monte Cristo. This is the Cask of Amontillado. Remember that? We talked about that. I think you guys were home when I was telling the story. All right, the guy that seals himself into a wall. All right, this is what happens. It's like the painter that paints himself into a corner and he can't get out of it. All right, so this cell has made all this osteoid, all right, which is an organic matrix, and it starts to harden. And it seals itself up. All right, when that happens, all right, it converts itself into an osteocyte, which is a mature bone cell, and its job is going to be just to maintain the matrix around it. All right? So it traps itself in that bone matrix. And at that point, it turns itself into an osteocyte. It's just going to hang out there. Right? And so its job, when I say it's going to maintain the bone matrix, it's going to determine if there's increased stress on the bone. Right? Say you go to a different planet, and the force of gravity is 10 times stronger on that planet than it is here on Earth. You're going to grow more bone to withstand that stress of that higher amount of gravity. Okay? So that's what the osteocyte is. It comes from the osteoblast. It's a mature bone cell, right? And when it detects changes in the bone matrix, either increase or decrease, mainly the increase in stress, mechanical stress, let's say, increased weight, all right, then that's going to cause the bone to make more bone. All right, we're going to grow more bone and create new bone to help deal with that stress. All right, so eventually osteoblasts will transform or turn into the osteocytes. Well, if we're going to make bone, we got to take it down. And that's where these guys come in. The osteoclasts. They're cool. They're cool cells. I like them. They're huge. They're phagocytic. I love phagocytic cells. Macrophages, or awesome neutrophils, all these guys. Well, osteoclast is a phagocytic cell. It goes around and gobbles things up like Pac-Man. It's multinucleated, right? So at one point you had a bunch of smaller cells. They fused together. And they decided to join together like Voltron and make a huge cell, okay? It comes from, you need to know this, bone marrow, right? So the area of the cell that comes in contact with the bone, right, has this type of characteristic. They call it a ruffled border. So you have the cell, looks like a jellyfish almost, because it has like these little tentacles that hang down. All right? So say your bone is here. This is the bone. So this ruffled border here, all right, is going to be exposed to the area of the bone that we want to destroy. And it releases these enzymes, these digestive enzymes. And it's like pouring acid onto a surface. It just eats through, right, the actual surface there. And that's what happens here. Okay? So the osteoclast will produce, all right, these digestive enzymes, and it'll start to create a depression pit type of area, which we call the resorption lacuna. All right. If you've ever, I broke my left tibia when I was in 4th grade, long time ago. There used to be a bump on my shin. Over years and years and years, it got smaller and smaller and smaller and smaller. And it was because of the osteoclast. They resorbed that bump. Okay? That's what they did. They released their enzymes and they just chewed away on it until it went away. Okay? So we're going to see the osteoclasts, their job is going to be to destroy the bone. So here's what we're seeing. All right, we're talking about the osteoprogenitor cell. So you have an osteoprogenitor cell. It'll divide, okay? It'll produce an osteoblast, and then it'll have another osteoprogenitor cell. The osteoblast will build bone, okay? When it's done building bone, right, and it seals itself in to the bone matrix, then it converts into an osteocyte. All right, and then here you can see our osteoclast over here. Okay, you have all these bone marrow cells that have fused together, hence the multinucleated aspect of the cell. And then it has these tendrils that hang down, right, with the digestive enzymes, and it starts to just chew away, right, at the bone matrix here. And actually, that's how you get calcium from your bones. You stimulate osteoclasts, they go to town, and they start to digest the bone matrix, and it releases calcium. And it goes into your blood. And that's how you increase your calcium levels. We'll talk more about that too. See how much you have to look forward to? Cool stuff. Okay, so we learned the players now, right? We know who's involved. Osteoprogenitor cells, osteoblasts, osteocytes, osteoclasts. Now, we're going to talk about the ingredients to bone. Okay? So we need to understand what the bone matrix is made up of. And you heard me say this before. Okay? Our bone matrix, our bone, is made up of organic, right, which is the osteoid, and then the inorganic, which is going to be the bone salts, calcium, phosphate, all that stuff we're talking about. So I'm going to talk about the organic components because that's the one that gives people a little bit more trouble. Okay? So the organic component is made by osteoblast. Remember, B blast, B build. And their job, you saw it on the previous slide, is to synthesize and secrete osteoid. So what is osteoid? Okay, collagen. And we add a little bit of ground substance. So what's our ground substance? Proteoglycans, okay, which are proteins and sugar, and then glycoproteins. And I'll talk a little bit about what those are. But for right now, all right, our ground substance, because remember, what is connective tissue? Cells and extracellular material. Well, the osteoblast is our cell. Our extracellular material is going to be, what did I say? Ground substance and protein fibers. So there's our protein fibers with the collagen, and then our ground substance is going to be proteoglycans and glycoproteins and water. Okay? But with bone, not so much water. Okay? So it's the organic component that gives bone what we call its tensile strength. Okay? What is that? That's what makes bone flexible. It's not very flexible, all right, but it does have a little bit of a bend. All right, believe it or not. You don't want your bones not to be able to bend a little bit, all right, because if they didn't have any tensile strength, you'd snap them. Okay? So it's the organic component that gives bone its flexibility, its tensile strength. So do you feel okay about osteoid? Not too bad? All right, the osteoblast makes the osteoid, secretes the osteoid, okay? But now we have to harden that osteoid because we got, our bones hard, right? It's not soft like our skin, okay, or our muscles, it's hard. So that's where the inorganic component comes into play, okay? So that's these guys, all right, the bone salts. We give it a name, all right? So you see up here, you see a bunch of molecular formulas, all right? Calcium phosphate, all right? You can also see we have calcium hydroxide, all right? Hydroxyapatite. This is the one. Don't worry about the, I will never ask you, all right, to give me the molecular formula for anything. Just showing you what the ingredients are. Calcium, phosphate, hydrogen, oxygen, all right? You see the ingredients in our hydroxyapatite. See, that's what we're looking at. This is the important, this is the one I really want you to know, hydroxyapatite. Basically, the calcium phosphate is going to interact with the calcium hydroxide, and it's going to form these crystals, bone salts, bone crystals, hydroxyapatite. And that is going to then interact, right, with the osteoid. All right? The calcium, excuse me, the collagen fibers. So basically, these crystals will be sprinkled around, all right, the collagen fibers, and then that will cause hardening of the matrix. So your bone goes, it's like wet cement. And then when we add this final ingredient, the hydroxyapatite, all right, when we add that into it and sprinkle it around the collagen fibers, that causes the osteoid, the organic matrix, to harden. And that's what makes our bones stiff. That's what makes our bones rigid. Okay? Look at all the other stuff that is also located in our bones. All right, sodium, oh, one of my favorites, magnesium. Magnesium is used in over 600 chemical reactions in your body. It's a lot. So we want to keep a bunch of it on hand. All right? So we'll see a bunch of this stuff, all right, in your bone. Fluoride. Not only has anyone ever done a fluoride treatment at the dentist? My kids get mad at me when I have to do it because they said it feels awful. Do you do them, or you've had it done on you? Oh, okay. Yeah, I don't know. I'm like, well, I brush my teeth with fluoride toothpaste. Yeah, I know. My kids hate me. My daughter got really mad at me the last time I had her do it. She wouldn't talk to me for a while. Oh well. Okay, she's since forgiven me though. Okay. So now we know that there's two components to bone: an organic component and inorganic. We know what is involved. Now let's learn how we make bone. Okay? Real simple. First step. Step number one. Start with osteoid. Okay? What makes the osteoid? Osteoblasts. The osteoblasts will make the osteoid. So they start squirting it out all around them. Okay? So they're squirting it out. Okay? Then blood is going to bring in the ingredients for this process, which is calcification. What are the ingredients? Hydroxyapatite. So the hydroxyapatite is brought in, okay? It collects around the collagen fibers, all right? Calcium and phosphate are going to come out and precipitate into those crystals and form that hardened bone matrix. Okay? So we need some things that are in our body to help for this process to occur. All right? Vitamin D is one of those things. All right? Cholecalciferol. All right? The active form that your body will use is calcitriol. All right? But what it does is vitamin D is going to help absorb calcium from your digestive tract. Right? Because we need calcium, right? That's how we're going to make the hydroxyapatite crystals. Right? Vitamin C, believe it or not, is important because without it, we can't make collagen. We can, but it's crappy. It's garbage. All right? So you actually need vitamin C in the formation of collagen, all right, because it clips off the tethered ends of collagen. Collagen goes through a series of formations, but at one point, all right, there's near the end of its formation, it has these tethered ends here. Okay? And so what vitamin C does is it goes, cuts it off. Otherwise, it stays on there, and the collagen you get is garbage. All right? Because back in the day, when a lot of our sailors were on months-long ocean voyages, and I'm talking like Christopher Columbus days, back in the 1400s or whatever, right? A lot of those sailors had experienced bleeding gums that would ulcerate, or they'd get what's called petechial hemorrhages, these small little red dots along, all right, their shins. Ever wondered why pirates had such bad teeth? All right? It wasn't because, well, it was because they probably got into a lot of fights and whatnot, but they were malnourished, right? And so a good supply of vitamin C is lemons, oranges, citrus fruits. So they started shipping those on those long ocean-going voyages. You heard of scurvy? I used to know why they came up with the term scurvy. I can't remember actually where that derived from, but you would hear it if you've ever watched Pirates of the Caribbean. They'll use that term a lot. Use scurvy swab or that. And there's I can't remember what that came from. And then, of course, we need calcium and phosphate for that process of calcification. So, in your notes, you want to make sure that you understand. Think of calcification as the hardening process of the bone matrix. Right? And it's because we're depositing the hydroxyapatite into that bone matrix, and calcium and phosphate, right, form those crystals. Okay. All right. So that's how we make bone. Let me go back one. All right. So bone formation. Now, let's talk about bone resorption. Okay? So when we talk about resorption, we are going to take back what we made. So the osteoclasts, all right, release these digestive enzymes, all right, from, guess what? Lysosomes. Remember those guys? Those are membrane-bound organelles, all right, that produce these digestive enzymes, all right, and it's these lysosomes create these or produce these proteolytic enzymes, and it will coat, all right, that ruffled border there of the osteoclast, and it breaks down the organic component of our bone matrix, the organic component. So if it's breaking down the organic component, by default, it's releasing the calcium and phosphate crystals. Because remember, the calcium and phosphate crystals would attach themselves onto the collagen fibers. So these digestive enzymes now are digesting away the collagen fibers, and guess what happens? Calcium and phosphate are now released, all right, especially after hydrochloric acid, which is another digestive enzyme, okay, that's being produced, will actually release specifically just calcium and phosphate. It won't be attached to hydrogen or oxygen or any of that stuff, okay? So hydrochloric acid allows for calcium and phosphate then to be released into the blood. And it can go throughout the body, it can go somewhere else in the bone, all right, wherever. But that's how we are going to get, all right, that calcium and phosphate liberated from the hydroxyapatite. So we'll see this when you have somebody that's what we call hypocalcemic. Right? Hypocalcemia is low blood calcium levels. Hypocalcemic. So it makes sense, right? You're hypocalcemic. We're going to release calcium into your bloodstream. At the same time, though, vitamin D, you saw what that does, right? Helps to absorb more calcium from the digestive tract, from the intestines. Okay, that's why you want to have vitamin D. All right, we're going to talk about some of the hormones and how they play a role in this. Okay, so that's bone resorption. Bone formation, right? Got the organic and inorganic components put together. Okay, bone resorption, now we're separating them. All right, and that's what our osteoclast. Easy to remember, the osteoclast has one job. Okay, to resorb the bone matrix. Release its enzymes, break down the organic components, liberating, all right, the hydroxyapatite, hydrochloric acid that breaks down the hydroxyapatite crystals into individual calcium and phosphate ions that get released into the bloodstream. Okay? Then if our blood calcium levels rise, all right, and they go back to normal, then we just shut down the osteoclast activity. Then we're not releasing any more calcium into the blood. Simple, okay? All right, what are we looking at time? I'm tempted. All right, let's stop here. This is a good place to stop, all right? And plus, you've already seen this. We already know what osteons are. So this is good. We can ease into this on Thursday. Today's Tuesday. On Thursday. Folks at home, meet me in the lab in about 15 minutes, okay? And if you have any questions, just ask me there. Any questions? Well, just ask me there, because I know as I stop recording, this is going to crash like it always does.